Welcome back to Kimplicity. Hi, I'm Kim Marie Ross, and this is Dr. Isaac Fili-Monvicius, more commonly known as Dr. Isaac, one of the top colon and rectal surgeons in the state of Minnesota. Welcome.
Thank you. Thank you for having me.
You're welcome. So you have performed over 50,000 colonoscopies. Why so many if you're a colon surgeon?
Well, it's a very good question. Yes, we're trained to do big operations to treat disease, but our biggest duty as a doctor in any specialty should not only be treating disease, but preventing it. We're very lucky with colorectal cancer that it should be a preventable disease. The way we do this is performing colonoscopies, because colorectal cancer today is the second leading cause of death in men and women.
Really?
Only behind lung cancer.
Wow. And it's that preventable?
It should be preventable if we follow the guidelines and you don't follow on the risk groups which are not there. It should be preventable in most of people.
Okay, risk groups. Okay, so can we do something in our diet to help prevent it?
Well, diet is extremely important for health and well-being, but diet does not prevent or cause colorectal cancer. What we have to do is to follow the guidelines. We choose to start being screened at age 50 for people without any other added risks.
Okay.
And then every 5 or 10 years, depending your risk and your colonoscopy, when you should have your next one.
Okay, so I had a polyp that had to be removed during my colonoscopy. I now have to go in every 5 years, correct?
Correct.
As well as my siblings now have to follow those guidelines as well.
Exactly. Polyps are extremely common. 3 or 4 out of 10 people have polyps.
Okay.
But not all polyps are precancerous, and from the precancerous polyps, only 5 or 6 out of 100 polyps will turn into cancer. So our duties as doctors is find these polyps when they're small, remove them,
Right.
and by then we're preventing colorectal cancer in some patients. And it is definitely cost effective to do that. It is a simple test. Should be a painless test done in expert hands.
I have to say it was really easy.
It was really easy for me too. The
right.
prep is easy, the facilities are great. Make sure you choose somebody who's competent to do
Yeah,
that.
I can fully attest to that. It was really just so simple. So you shared a story with me about a gal who was just completely fit, healthy, did everything perfectly. Share that story with our viewers.
You know, most of people come and have a colonoscopy and it's a breeze. It's either clean or they have some polyps, which is very common. But in other people are not as lucky, or I believe they are because we find something.
Right.
This was a young woman. She was in her middle 40s and she came in because she had some change in bowel habits.
Yep.
It is important to know that colorectal cancer is a silent disease.
Yes.
You don't come to the doctor when you have symptoms. We have to get a large population and screen them to find them.
Right.
But this lady had some mild symptoms,
Right.
came in, and she was talking to me. She was preparing for a marathon. She was extremely fit, vegetarian, eating very healthy.
Yeah.
And we're talking about some people we know in common. She's awake, very comfortable during the
Yeah.
procedure. I insert the scope, and within a minute, I find a very large cancer.
Oh, my.
And many patients are watching the screen by their choice. So she asked me, what's that? And I said, well, that's a cancer. She says, what do you mean I have cancer? I feel perfect. And that's the story with this.
Oh.
You don't feel bad with colorectal cancer.
Right.
Once you start having symptoms, it's usually too late to treat the disease.
Right, okay, but there was a happy ending.
She did very well. She had surgery. She had surgery,
Yes.
and she's 5 years free of disease. I've
Okay.
seen her in multiple follow-ups. And fortunately, colorectal cancer, even if found and treated early, in most of people, it's a curable disease.
Okay.
But our duty as doctors is not only that to treat the disease. Let's try to prevent it as much as possible. It is interesting that in Minnesota, we screen approximately 65% of the population correctly. Nationwide, only 33%.
Wow.
Minnesota is the only state, or one of the only states in the country, where colorectal cancer is going down. So we're doing better than everywhere else.
Oh, that is good news.
It is good news. The only test that goes in, sees a polyp and removes it, it's a colonoscopy. There's
Okay.
many tests, and one that just came out that looks for abnormal DNA in the stool. And unfortunately, I believe that's too late when we find that.
Right.
Because these are tests that are looking for very large polyps or cancers that we could have prevented
Right.
3 or 5 years ago with a colonoscopy. In many of these tests, they miss a large amount of these small polyps that could be removed and prevented.
What about complications during colonoscopies? I had a fear about having one done. I mean, perforations. What if they miss something? Can you share with our viewers?
Absolutely. That's the reason why we take everything seriously. Even though a colonoscopy is a simple test, and even though we say we've done 10,000, 50,000, as many as you want,
Right.
we take every colonoscopy as the first one. We have to be careful. We have a system where we protect the patient, we monitor the patient, but it is very rare in expert hands to have a major complication. I would like to say at the end, if you have not had your colonoscopy and you're 50, have it. If you have had your colonoscopy and you had a good experience, talk to your friends, talk to your family, spread the word. We are screening 60% of the population, but there's still 40% of the population that we can help. This is not a financial thing. This is not a financial gain for physicians. This is of good health and good prevention for you, the patient.
Well, this was really powerful information, and I believe life-saving information.
Thank you very much for having me. To me, it's an honor and a pleasure, and I believe it's a duty of all physicians to try to educate the public, our patients, and our colleagues on trying to do the right thing.
Well, thank you for all that you do. And stay tuned for more Kimplicity, and God bless.